Welcome to the DFSM Provider Training Team training on documentation for claim submission and concurrent review. One of the most frequent questions we receive from providers is what documentation is going to be required to ensure that their claim will be paid successfully. First and foremost to know is that providers do have the responsibility to provide access with any requested documentation. This can be requested from the providers involved in providing care to the member, including the rendering provider. It's typically used to substantiate that the treatment rendered or the health service provided met access policy requirements, and that the delivery of services noted within the claim submission match what was actually performed. Requested information may include, but is of course not limited to, more detailed or itemized statements or records, medical records like office notes, operative reports, medical records, physician orders, progress notes, and diagnostic test results. Medical review is a function of CMSU, and they are the ones who would be using the documentation submitted. Medical review is typically required prior to adjudicating the claim and determines if the services are medically necessary and audits the appropriateness, utilization, and quality of service provided. If documents are needed to complete a medical review and Access does not have them on file, an automatic request for documentation may be initiated. Providers who have submitted their claims on the Access online provider portal should check there. Typically, it will show in the portal and they will know what they need to submit. If required documents are not received, a denial may be issued. There are some claims that may be subjected to documentation request, and these include, but again, are not limited to the following: claims for federal emergency services members. Federal emergency service claims can often be medically necessary. However, they may not meet the federal definition of an emergency service. And because there is a requirement for any claim for an FES member to meet the definition of emergency service, if medical review determines that this is not applying, then the claim would not be paid. Other types of claims that would have additional medical review include ones for unlisted procedure codes, claims for services that require supporting clinical or other information to determine whether they're payable, or claims where documentation is required by other entities like CMS or under other state or federal regulations. Another type of claim that we would require additional documentation for would be a near duplicate claim. A near duplicate claim is for the same procedure on the same day for the same member for different providers. Our claims processing system, or PMMIS, will place these claims in a pending status, and they will require medical review to ensure they are not the same claim. We may need documentation to substantiate a member's eligibility, that a provider is Access registered, that the service requested is an Access covered service per our Access policies, that PA requirements were met if required, and that the service requested is not covered by another primary payer, for example, a commercial insurer, Medicare, or another agency. These services may require documentation, but this is not an all-inclusive list, by report procedures, multiple surgery claims, federal emergency service claims, members with a retro eligibility status, and procedures that get billed of certain modifiers, including non-emergent hospital admissions, dialysis services, and secondary payer claims. This particular grid can actually be found in the Fee-for-Service Provider Billing Manual, and we have this linked below in the description. It goes over different services that would be billed for on a professional claim form and what documents are required. This particular grid, also linked in the description below, can be found in the UB04 chapter of our Fee-for-Service Provider Billing Manual, and it goes over the different services that have additional documentation requirements that can be billed on an institutional claim form. Last but not least, there are also some general documentation requirements that surround documents that shouldn't be submitted unless a provider is specifically requested to do so based off the claim type. Things like an emergency admission auth form, patient follow-up care instructions, nurse's notes, blank medical documentation, consent for treatment, operative consent form, ultrasounds and x-rays, Medifax information, nursing care plans, DRG coding forms, medical documentation on prior authorized hospital stays, unless, of course, the claim qualifies for an out-of-year payment, and entire medical records. If you do need additional information, we have additional information on our provider training webpage in the form of a PowerPoint presentation. Thank you for attending our overview of documentation requirements.